Prynhawn everyone. Welcome to our keynote session today. We're delighted to be joined by Jane Hutt as part of this year's Wales and Africa Health Links Network conference. I'm hosting the session. I'm Claire O'Shea. I'm head of Hub Cymru Africa. So I'll be supporting the session. So I'm just going to run through a few housekeeping points before I hand over to Bernadette from Wales and Africa Health Links Network. So this event will be a webinar format, which means that only panelists can share their microphones and videos for now. You'll all be muted for the session. You are very welcome to contribute to the discussion or make comments, and we would love you to pop that in the chat box function on the right-hand side of the window. And to send questions, please use the Q&A box on the right-hand side of the window. We are welcoming oral contributions, and you are able to join the panel on stage, and you can raise your hand to do that, but we would like you to pose your question in the chat box first so that we can make sure we're not asking repetitive questions. Bernadette will allow time for questions to be dealt with at the end, depending on how the session is running. And of course, we always really value your feedback. So we'll ask you to complete polls at the end. And just as another aside, any form of abusive or offensive language or behaviour in the chat boxes or throughout the session won't be tolerated. So we ask that you please listen with respect and be mindful to the experiences of others. So I'm now going to hand over to Bernadette Fuge, who is a long-standing trustee of the Wales and Africa Health Links Network. She holds several other positions of note, including I think it's president of Age UK in Wales. You'll be able to clarify that much better than I can. So I'm just going to disappear from the screen and hand over to Dr. Bernadette and our Minister Jane Hutt.
Thank you very much, Claire. Yes, I'm very pleased to be a member of the network of the health network that supports and advocates for all partnerships between Wales and Africa that are involved in health activities. Wales and Africa Health Links Network is a charity. All of our trustees are volunteers, and we rely on the tremendous support of the Hub Africa team for events like this. So thank you very much to the team. I'm going to have the great pleasure of introducing Jane Hutt, who has worked in the National Assembly and then Welsh Government. And I was fortunate to be in the Health Department as a civil servant when Jane was Minister for Health and Social Services. So I'm asking her to welcome you all to the afternoon sessions of the Wales and Africa Health Links Network Conference. Jane is now the Minister for Social Justice and holds responsibility for the Wales and Africa programme, which became part of the social justice portfolio in May 2021. A move that was welcomed by the sector, as we in Wales can be very proud that our government values global solidarity work as justice. In the face of climate change and COVID-19, it recognises the importance of the role we have to play in addressing health inequalities. We're fortunate to have the Minister with us today. She has excellent links with the work we do in Wales and Africa. She spent part of her childhood in Kenya and Uganda, which has given her much insight into the challenges that the programme seeks to address. She has also continued to work on links between Wales and Africa, having held the post of patron of Wales and Africa Health Links, a trustee for Vale for Africa, a link between Tororo district in Uganda and the Vale of Glamorgan. So we are all looking forward to hearing what Jane has to say at this key time for global health. Thank you. Thank you for coming, Minister.
Thank you very much. Thank you so much. It's great to be introduced by Dr. Fuge, a great friend and colleague. I would say when you're a minister, to have people and professionals at your side, like Dr. Bernadette Fuge, I was health minister, is such a huge privilege and opportunity to help get things right in terms of policy and delivery. But also lovely to see you, Bernie, with all the things that you continue to do in your busy life, particularly important with the Wales and Africa health links. And so thank you for introducing me to this really important conference today. It's the annual conference, of course, of the Wales and Africa Health Links Network, and such a valuable event. I know that all of you who've come together are all very busy people, but you've seen that this is a place to be where we can all learn together and share experience and the will and the commitment to move forward and to make progress at this most challenging of times. So I think you've chosen such a good theme, a theme of global citizenship and global solidarity, as you say, Bernie, that we want to embrace in the Welsh Government and through the support of the Wales and Africa Health Links and the Wales and Africa programme. It's a very significant time to choose this theme of global citizenship with the last 20 months of COVID devastating communities around the world. And of course, always remembering, not just for us here in Wales, our local communities, friends, neighbours, services, but worldwide. But of course, we do recognise that it actually has brought communities closer. And I just, your theme of global citizenship is so important, but it is now widely recognised in today's world. And I think there's generally a shared understanding of what it means, but good to be able to reflect on it and what it actually entails so that we can recharge ourselves and renew our commitments to making this actually meaningful. We don't want to devalue or misrepresent what the expectation should be, particularly of governments, of global citizenship. So thank you for giving us this opportunity. And in Wales, we have the Wellbeing of Future Generations legislation. We're 5 years on that pioneering Welsh law. So for us in Wales, we will measure active global citizenship in our updated set of national wellbeing indicators, which we use to measure progress towards Wales's 7 wellbeing goals. You will be aware of this in Wales, and we share this, of course, at great interest across the UK and the world about the way that we're moving to have these indicators, wellbeing indicators, and these wellbeing goals. But of course, what we would do as a result of our measurement of our active global citizenship is capture whether people have donated, volunteered, or supported a range of international issues such as global poverty, human rights, and climate change. And I don't know about, when I'm not up in COP, I won't be able to go. I'm actually hoping to speak virtually. But we have seen, as a result of the very good coverage of what's happening in Glasgow, this light has been shone on what climate change means now in Africa and in the countries and that we support and link with and across the world in the Pacific. It just is so clear what climate change means now, alongside the devastating impact of the pandemic. So for me and for the Welsh Government, we feel that a global citizen is someone who not only recognises the issues on their doorstep in our communities and in our countries and nations, but also that we're aware of the wider world with its challenges and complexities and the deep inequalities that stretch from, as Bernie has said, the health inequalities that have deepened as a result of the pandemic, not just here for us, but across the world. Of course, it's also looking at what does this mean as a citizen, as a human being. It's about looking around your own community to see where you can take an active role in supporting others, considering what your role could be in making the world just generally a fairer place in any numbers of ways. I mean, it is a simple concept, but I think often the best way forward starts with simplicity and a clear direction. And it's the concept we employed at the Welsh Government when we created what was then the Wales for Africa programme 15 years ago. I mean, 15 years ago, I was
I think you're on a mute, Claire.
I think we've possibly lost the minister. Please bear with us for a couple of seconds whilst we try and bring her back, possibly a broadband connection. Bear with me, I'll just be disappearing from screen a second to bring her back on.
Was the First Minister, and we had a strong desire in Wales to contribute to international development, social justice and global solidarity. And the Wales Africa Health Links Network has clearly instilled these values into our work. And what's most important is that what we've learned over the last 15 years, so much has happened, so much has changed as we adapt to an ever-changing world, and we continue to adapt to the new challenges and opportunities that we face. So I've mentioned back in 2015, we introduced the Wellbeing of Future Generations Wales Act, but leading up to that act, the Sustainable Development Alliance and all those partners who worked hard to bring diverse voices from all across Wales into the process, not least ensuring that the need for a globally responsible Wales was reflected in the goals. An important part of establishing Wales as a globally responsible nation, we committed in our 2020 international strategy last year to expand and rename the Wales for Africa programme, as I've said, as Wales and Africa, better acknowledging the mutually beneficial partnerships between us all. Health linking was actually one of the first initiatives born out of the programme. From a small group of like-minded health professionals, the work has grown and developed into serious and impactful programmes that are making a difference to people's lives, both in Africa and in Wales, and driving up standards and understanding and learning across the board. And there's been some excellent partnerships developed and formed over the years with the expert support from the Wales and Africa Health Links Network and organisations like Hub Cymru Africa, helping to navigate groups in Wales who want to further develop projects and activities mutually beneficial, that's crucial, with partners in Africa. And it makes me so proud of our Welsh NHS and the way they've embraced the importance of international health linking and the benefits to all involved. Being involved in a health link with Africa is clearly a unique and highly valuable experience for Welsh NHS staff, both personally and professionally. And it's an important part of our Welsh contribution to tackling global poverty and inequality. And it's thanks to this sort of work and through those very well-established links that have been forged that Wales was able to respond quickly and effectively to the unfolding COVID crisis in Africa. Through our Wales and Africa Small Grant Scheme delivered by the Wales Council for Voluntary Action, we managed to refocus the budget so that we could help Welsh organisations help their partners on the ground in Africa to respond to COVID in a number of different ways. And this support has been helping children get back to school, providing clean water and soap stations and essential PPE. It's raising awareness about COVID, dispelling fake information, stressing the importance of getting vaccinated, helping people get digital access and assistance in areas that previously couldn't provide this. But we've also looked for other ways to support countries where it's most needed. And I'm really proud of the recent PPE donation that was sent to Namibia to help deal with their third wave of COVID. But this was an excellent example of true partnership working to make this happen swiftly, getting this PPE to places that have been crying out for support. And it's responding to the partnerships that has made this happen. So I'm proud of what we've achieved during this difficult time, but we're nowhere near the point where we can say there's not more that we could do. We clearly have got to rise to the challenges that are still with us, because many countries, particularly in Africa, are still in the eye of the storm with COVID cases and deaths rising, whilst tackling emerging new variants. And if we're truly to call ourselves a globally responsible nation, we have to look for opportunities to give people the tools that they want to seek to help them out of these difficult times. Vaccine inequity is absolutely the biggest obstacle stopping the world emerge from this pandemic. Although vaccine distribution is not a devolved area, the First Minister has urged the UK government to accelerate the supply of vaccines to the developing world, and in particular to the places with strong links to Wales, such as Uganda, Namibia and Lesotho. And I make that call again today. We must speak in unity to those in control of vaccines to consider ways to get vaccines to where they're urgently needed and quickly. But whilst Wales can't send vaccines, there is important work that we can support. We know that vaccine hesitancy and lack of awareness in Africa is a major concern, along with lack of oxygen, lack of PPE and the training to use it properly. So small grant activity delivered by committed people really has made a difference to the lives of many people. But we also want to offer larger grants to deliver larger scale activity. And that's why earlier this year, we made available an extra £2.5 million for Welsh organisations to work in partnership with many countries in Africa to fight against COVID. And that's about, being able to be flexible and nimble as a government to respond and to change direction, to repurpose. And we've done this, through this ability, we've supported Namibia and Uganda through partnerships with Pont and the Phoenix Project at Cardiff University, where work's currently being delivered to ensure better oxygen supplies are in the right places at the right time. And also training is being delivered to hundreds of nurses and doctors to manage these oxygen supplies. Cardiff-based United Purpose was given a £600,000 grant in March this year to provide a rapid emergency response to COVID in Nigeria, the Gambia, Senegal and Guinea, reaching approximately 4.4 million of the poorest people in the world. And this funding is being used to develop a high-impact awareness-raising scheme, providing wash facilities, and also to help those people who've lost their entire livelihoods as a result of COVID by developing training and support. We also provided Teams for You with a £125,000 grant in March for their project in Uganda, which was to improve sanitation and also supporting menstrual provision in health facilities and schools, which was necessary to meet national COVID compliance policies. And the project will ensure that hot running water will be plumbed into delivery and operating theatres in the only government-run hospital, which will make a critical difference for the safety of both staff and patients in that region. And running water will also be plumbed directly into 24 health centres, seeing up to 300 patients daily, covering all aspects of community healthcare. So this is about new indoor shower and toilet facilities being built at the health centres, and recent feedback has been shown that healthcare workers, particularly women and girls, feel a lot safer using these facilities than the older ones, which were often outside and often situated in unlit and potentially perilous areas. But I also wanted to quickly highlight, again, the work of the Phoenix Project between Cardiff University and University of Namibia, where they did some excellent work in partnership when they received a grant in March of £125,000 to roll out a vaccination promotion programme in Namibia, because Namibia has suffered with vaccine hesitancy, especially amongst vulnerable, remote and disadvantaged communities. So the Namibian Ministry of Health and Social Services, University of Namibia and Cardiff University co-produced health promotion awareness campaigns for 90,000 of the most disadvantaged people, including disabled people, the elderly, and also prison inmates. And then they delivered the vaccination program itself, saving many lives. I know there is some really excellent work being delivered with Wales and Africa Health Links. For example, with Betsy Cadwallader University Health Board, and also the Swansea Bay Charity, and many, many others. And there's others probably we're not even aware of. We know that they exist. There's too many to mention now, but it's thanks to you that this work is underway and progressing and ongoing. And of course, you are giving your time to work on projects in Africa over and above all your professional commitments. But the benefit and the reward in terms of the recognition that this is about global citizenship, and from a professional perspective, from a clinical perspective, I think is something I'm sure that's coming out of this conference today. I mean, it is hugely rewarding to know that you are here for the world and not just for yourself and your family, community and nation. I just want to finish by saying it's so important that we see more work and linkages with diaspora communities in Wales. Any activity undertaken in Africa should be less about us making decisions and doing the work, and more about empowering people in these communities to identify and deliver what's needed. We've got to support more of this work in the future. So it is about that partnership, and we've learned so much over the past year, which is reflected for us in Wales in our race equality action plan for an anti-racist Wales. We've learned a lot about power and learning how we tackle deep inequalities. If you tackle them here, you're tackling them, and you reflect them as you develop programs and help to tackle inequality across the world, even in a very small way. That kind of recognition of what global citizenship means in terms of sharing power, sharing resources, it to me is so important. It helps drive me forward as Minister for Social Justice in this Welsh government. So in Wales, we'll continue to look outwardly to other countries to help us better understand our role in the world, to learn from each other about what solidarity really truly means, how we can work together to create opportunities for fairer lives, challenging health inequalities wherever we see it, rebuilding the future with optimism and strength. That surely is what global citizenship is all about. And I think, we can strengthen and make those links in terms of our recognition now of the challenge of what climate change is doing in those communities and countries that we are linking and sharing our resources with, and how we can link this to the all-important work of the Wales and Africa Health Links Network. I'm sure there's going to be lots to learn from the rest of this conference, and very good networking, I know, later on. Will want to have some feedback, please. And I think possibly time for any questions or comments that come from you. We need more collaborations to be forged. Wales is stronger if we are a global citizen, if that's the way we think and act, through global citizenship. So for me, this is just a great opportunity to share those thoughts, and also account for what we have been seeking to do over the past 2 years of really challenging times. Thank you for all you do. Diolch yn fawr.
Many thanks, Jane. Many thanks. You've agreed to accept questions.
Bernie, I'll field I'll field a question to you, Bernie, from Catherine, who is the chair of Wales and Africa Health Links Network. And Catherine, I won't invite you onto the... would you like to be brought onto the stage? I will bring you on. Her question is, how could cross-government working support this? I'm bringing you on, Catherine. Oh, it's sorry, it's not allowing me to bring you on. We're getting used to the technology. So how could cross-government working support this, from Catherine, the chair of Wales and Africa Health Links Network?
Well, thank you very much, Catherine. My role as Minister for Social Justice, I have a lot of responsibilities in my portfolio, but in terms of making sure that the whole of the Welsh Government actually works together to deliver social justice, means that you have to work across government. So crucially important, I think, for the network, crucially important for the way forward, particularly with all the work that you've undertaken, that all important survey and mapping of the links that already taking place across between Wales and Africa. Clearly, we have to have particular cross-government action and working with our Minister for Health and Social Services, but also I think increasingly with our Minister for Climate Change. I mean, it's interesting, the 6th Senedd, the First Minister created these two new ministries, Ministry for Climate Change and Social Justice, and they're sort of the guiding forces behind the government. But cross-government working is crucially important in terms of priority, of policy, resource allocation. We've just had the CSR. It's actually much tougher than it might have sounded for us here in Wales. So it's going to be about, making the case, which I, as lead minister for social justice, have to ensure that my colleagues across the Welsh Government, led by Mark Drakeford, of course, actually deliver on this. So it's, but I think, we can show what that can be done, how we can do this at a kind of local, regional and national level here in Wales, and how that links to the wider picture. Just to say, I was very pleased that the First Minister put Wales and Africa in my portfolio. He's actually responsible for international development. But so I will do everything I can, Catherine, to try and forge this cross-government working to make sure that we do deliver on your aspirations and what you've done already.
Thank you. Any further questions, Claire, come through?
No more questions, Bernadette. We've got 1 minute left, so you're very welcome to sum up, and I'll end the session then.
Yeah. Well, Jane, I want to thank you. Many thanks for the depth and breadth of your presentation. You've certainly demonstrated the value that government places on global solidarity and the role being played in addressing inequalities. Many, many thanks. So good to see you.
Thank you very much, and good luck for the rest of the conference.
Okay, thank you.
Thank you. Bye.